Well, I am super excited to have Marie here. We just got done with what we call our end of phase 1 examination and consultation, Marie, where we go over results, right? How are you doing? And then we take measurements, we take x-rays, and we look at the knees. How are the knees doing? And you had an incredible story to share, which I said, wow, we need to get this information out there. Before we do that, you came in for the knee pain program. You had some knee pain, pretty severe on both sides. You had some back pain. We did a lot of work here at the office. You did a lot of work at home. We have you on a nutrition regimen. Let's talk about the knees overall. How much better did you say they're feeling?
Well, the right knee especially, I would say it's probably 80, well, good 70, 75, we'll say, at least, is most of the time.
Right.
The left knee, as you know, we got problems with that
Yeah.
not a whole lot you can do about that
Okay.
one, I'm afraid.
Okay.
But yeah, I'm just so tickled. And as the program went on, I used to drink sweet tea.
Yeah.
I don't drink tea anymore, I just drink water, except
Yes.
for my morning coffee.
Okay.
I always put sugar in it.
Yes.
And then one day, decided I wasn't going to put sugar. I was going to put stevia in it and see what happened. It was okay. I could drink it. It was
Yeah.
fine. The next day I did the same. Then the third day I went back to my sugar, and that day that knee bothered me. So the next day I said, okay, I'll do sugar again, just to see what was happening.
Mm-hmm.
It bothered me. Next day, and from now on, I use a stevia, and it's much better. I don't
Are you a
have it.
scientist? That's an
No.
amazing self-study that you did,
Well, I
because
did.
the stevia would be considered the control. Let's do it without sugar. My knees feel fine. You got to a point where that right knee, like you said, 70 to 75%
Yeah.
better. You're doing your stevia, you're doing your coffee, everything
Right.
seems to be good. And then you thought, you know what, let me just try a little sugar in here. And what you're saying is like that knee pain just came
comes
back. Curious. How long did it take to come back? So you had your cup of coffee with your sugar in it.
Almost the next, well, within, I'd say 4 or 5 hours.
Within 4 to 5 hours, you're thinking,
Yeah, as a
hey,
whole.
what's up? My knee is hurting. So as the scientist that you are or aren't, you decided the next day, let me try it without the sugar. You went to stevia. You didn't have knee pain.
I didn't have as much.
And then
no.
so you did stevia, and no knee pain. Have you
That's
done
right.
another test yet? Or are you afraid?
No, I'll stick to my stevia. Yeah,
You
and
are-
of course, I've cut back on my sugar intake
Yeah.
on other stuff as well.
Yes.
So it's probably a combination
Absolutely.
of all of it, because the
It's prob-
sugar
right.
can do it.
Yeah.
You know, and it probably affects all my whole body. If we get down to the whole thing,
Yes.
my knee's the one that gives me the problem. So.
Brilliant statement. You're absolutely right. It is unequivocally, sugar is affecting your whole entire body. So your lower back, kidneys, liver, brain, eyes. I mean, we know this from diabetics. People who are severe diabetic can get diabetic retinopathy. They can get kidney failure. They can get brain issues. Alzheimer is linked to diabetes. But what if you're not a full-blown diabetic, but somewhere on the spectrum? Maybe you're not even pre-diabetic. The question is does sugar also affect that person?
That's right.
And the answer is
I'm
yes.
sure. Yeah.
And what you said is brilliant, because you noticed it at your knee, which I would suggest is lucky, because most people who are watching this aren't able to feel what you feel, and they don't attribute this sugar to knee pain or the other symptoms and the other things that are all subclinical. So that's a big thing, and we talk about this here a lot. It's never a failure unless you fail to learn the lesson. So I think you've gained a big lesson here. Of course, you've lost a lot of weight.
Yeah.
Your back is feeling better
Oh, it's
as
much
well.
better.
How much
Much
better
better.
is your back feeling?
On my back's probably 85%.
Good,
Yeah.
good. So here's a warning, which I don't think I need to give to you, but essentially I like to tell people, if you go back to what you were doing, you're going to go back to getting what you were getting. So beware. This
Not
is what
going
sugar. Okay, good. That's the right attitude.
No.
So, and you just feel better. I
Oh,
mean, I'm not
yes.
talking about your back and your
My
knee.
whole body. My whole,
right?
The whole body my mind, the whole 9 yards. I feel better.
That's
Yeah.
amazing. That's amazing.
Well,
Well, thanks for
that's sad.
doing this interview, and
Oh, I'm
I
glad.
did get your permission already to
Yes,
share
you did.
this, right? So
You
we're
did.
going to get
That's
this
no
out to
problem.
people. I'm going to put it out there because people really need to see how our diets do affect us.
Right.
And here's living proof right
That's
here.
right.
All right.
It is.
Thank you
That's
so
right.
much. That was incredible.
Thank you so much. Yeah. And see, my dad was diabetic. So I
Mhm.
know what sugar can do to your body. You just do it, don't think. You
Mhm.
just use it.
Yeah.
That's-